Okay, good morning, everyone. Welcome to the Monday morning press briefing on COVID-19. As you have probably already noticed, we have a whole lot more people here with us today. We have opened an emergency operations center in connection with the COVID-19 response. We now have 3 different agencies who are participating together. The Health and Human Services Agency is now being joined by CAL FIRE and the Shasta County Sheriff's Office in helping respond to this growing incident. So we thank all of you for joining us this morning and participating in our 3 times a week online briefing. The way that we usually start these meetings is with a report on the numbers, which I'll share right now. We have a total of 20 positive cases, 446 negative cases. We have 15 people in isolation, 68 in quarantine, 2 people who have recovered, and unfortunately 3 who have passed away from COVID-19 as of today. I'd like to go through now. We usually introduce our hospital partners and allow them to give an update, and then we'll also expand that to include our new partners who are with us today. Can we start with, let's start with the, in that corner is Mayor's Memorial. Jen?
This is Val Lakey. I'm Mayor's Memorial. Jen is the Mountain Valleys. So
I'm sorry.
Like to hear from me.
Yes, I would love to hear from you, Val. Thank you.
Okay. So Mayor's Memorial Hospital, my name is Valerie Lakey. We're up in Fall River Mills. We have really no changes over the weekend, except for we have implemented a masking policy for our staff, and we put out all of those guidelines on Friday. So starting Friday afternoon, Saturday morning, all of our employees are following the masking procedures. Other than that, we're staying in close contact with our hospital partners in Redding and working with the clinics and just doing everything we can to be prepared.
Carrie, you're muted.
Well, I'm kind of new here, can you tell? Well, let's go to Jen next.
Hi, I'm Jen Andrea with Mountain Valleys Health Centers, and we have all of our clinics that are currently open. Our dental clinics are closed per the advisement of the California Dental Association. We anticipate those will be back up and open hopefully in May. We're all just kind of playing it by ear. We have implemented e-visits, and for those who don't have internet connection, we have also implemented telephone visits. We're in Weed, Mount Shasta, Bernie, Fall River, Beaver, Doris, and Toohey Lake. So currently we have lots of strategies in place to keep our staff and our patients healthy. Our staff, some of them are working from home, me being one of them. So we're all just adjusting to this, but currently we're just kind of day by day taking it. So that's it for Mountain Valleys.
Thank you, Jen. Dean Germano from Shasta Community.
Thank you. Probably the biggest news for us is we just started this morning our new respiratory assessment center, which is where our primary care neuropsych department was off the main campus. We've moved those folks, and now we're concentrating everybody with respiratory symptoms who comes to our 4 walls there to be assessed, and that way we can hopefully keep any risk out of the main building. And we, like a lot of folks, have really dialed into the teleconferencing, telemedicine types of options for our patients as much as possible. So that's my report.
Thank you, Mr. Germano. Mark Mitchelson from Shasta Regional.
Hi guys, Mark Mitchelson, Chief Nursing Officer for Shasta Regional. Much of the same as Friday, just encouraging our existing customers to use the Shasta Regional Medical Group virtual visits, and just working with the county as things progress and getting this FMS program over at the Civic Center up and running.
Awesome, thank you. And then Mercy Medical Center, I'll let you guys flip a coin and decide who's going to give your update today.
Hey, good morning. So this is Robert Fulden. I'm the Chief Operating Officer here at Mercy Redding. So we continue with our surge plans. We're doing some more testing this week with those plans, just to make sure that they're solid and that we keep our staff and physicians and patients safe. We continue to look at our infrastructure and plan for, again, what happens if we get more patient volume. So again, just constant state of prep. We did lock down all of our entrances, so we're restricting access to basically 2 entrances for staff, and we've implemented temperature screening as another line of defense in preparation. This week, we're really going to try and focus a little bit more on wellness, and I know that sounds odd, but this is a taxing time on our staff and our physicians, and certainly on the public. So if you have a family member here, we want to develop a better line of communication so we can let you know how your loved one is doing. And then we're going to work on a few things for our staff and physicians to continue to make it easy to come to work, to feel good that while you're at work, and then when you leave work, you feel like you're not potentially taking any of the virus home. So we're actually working on showers and whatnot so that folks can change their clothes before they leave. Just another line of what can we do to ease people's minds. Thank you.
Thank you very much. Those are all of our hospital partners. We'll go into our other partners. Can we start with you, Sheriff Magrini?
Thank you, Carrie. As was identified at the beginning of this press event here, we have gone in unified command, and that's basically through our Shasta County Emergency Operations Plan that was pre-existing. And it's not to say there was a deficiency or a lack of any effort on any single part, but as this continued to scope out and build out, it became apparent that we needed to kick this plan into place. And it's a good plan that the county has pre-established. And the reason that you're going to see the sheriff and myself and Chief Couvea involved is that's how the plan is identified. The sheriff as the director of emergency services here in the county has the authority and responsibility, and then it designs the fire chief as part of that structure as well. So this has been a very positive thing for us here in Shasta County, because we have a foundation already laid, we have the partnerships, we have the cooperation, the communication, and so it's just adding more components to this as it grows to help with span of control and just help with organization. So that's what we've done over the weekend. We started building this up. Today is our first operational period, and with Health and Human Services as part of the incident command team, they're new to this, which is great because we're getting to build this and cooperate together as we move this forward. So this is a very positive thing for Shasta County. I just want to reassure the media and the public that there is no nexus to any bringing law enforcement in or bringing fire in, because we think there's going to be anything in those 2 arenas from the public part of this, except for the fact that we're all partners and we're working together. So with that, I will pass off to Chief Couvea.
Well, thank you, Sheriff Magrini. Good morning, Brett Couvea, Shasta County Fire Department, CAL FIRE. It is our pleasure to assist HHSA and Public Health in creating an emergency management structure. One that is really, ICS surrounds all disciplines. It doesn't really matter if it's a fire, a flood, or a pandemic situation that we're dealing with. Emergency management and that structure is the same. And I view our role as a support role, and we're happy to do that. And we're honored to assist with HHSA and Public Health, along with the partners with the sheriff. Just kind of reinforcing some of what the sheriff said. That organization is coming together. We have assembled over the weekend an incident management team that's really multidisciplinary and multi-jurisdictional. And that's bringing all the county partners in, a lot of the departments for assistance. And that organization will likely grow as things increase here in the county for need. So it's really working well together already. Spent the weekend building it out, and as Sheriff Magrini said, some successful meetings occurred today and are ongoing throughout the day with the planning process, long-term planning, and other contingency planning that's occurring. So thank you.
All right, thank you, Chief Couvea and Sheriff Magrini. Donnell, do you have words to share with us this morning?
Thank you, Carrie. I'd like to thank Sheriff Magrini and Chief Couvea for Unified Command and for all their contributions. They're very experienced in emergency management and incident command, and they're assisting us greatly. We have been busy over the weekend. I'm sure everyone's aware that the Federal Medical Station arrived on Friday, and the National Guard was there on Saturday setting up all the equipment. We actually had a 250-bed cache delivered on Friday. It was split in half, and it was loaded back. Half of it was loaded back on trucks on Saturday afternoon and sent down to Butte County. It is being set up in Butte County today, 125 beds. And so we have a 250-bed cache for Region 3, which is a 13-county region from Sutter Yuba all the way to the Oregon border in the Sacramento, in this side of the mountains. And we are splitting the responsibility for that region so that it follows more the natural referral lines that the hospitals already have. So we'll be serving the northern half, Butte will serve the southern half. So those beds are set up, and the state considers that FMS operational. However, I just want to clarify that just means it's set up. It's not functional at this point because we do not have the workforce established nor all of the supply chains that we're going to need. But that is being worked on as we speak, and we have hired a administrator for the FMS, Eric Saliba. He was at the press briefing on Saturday. So that's what's going on with the FMS. I want to thank our school partners. I did reach out to them this weekend, and they are provided us with 7 nursing staff from their schools. They're going to be assisting us in our public health response. So they're going to be getting started this week. So that comes from a variety of our school partners. And I just want to thank Judy Flores, our superintendent of schools, for coordinating that for us. And I think I'll leave more of the medical and public health response comments to Karen Ramstrom.
Okay, thank you, Donnell. And before we hop over to Dr. Ramstrom and media questions, I wanted to also introduce Matt Pontes, the CEO for Shasta County. And Matt, do you have some words to share with us this morning? Matt, your audio is not working. Am I the only one that can't hear him? Okay, I'm afraid we have some technical difficulties. Sorry about that. We'll get those sorted out, and we'll try and catch back up with you by the end if we can figure it out. Thank you. He's given a thumbs up to all of you for your great work. Ramstrom.
Good morning, everybody. So, I guess I would just really like to reiterate what we've been sharing for some time now, the importance of really trying to limit our contact with others, whether it be if you're working in an essential function with your colleagues or with other people that you have to be around in your day-to-day to meet other people's needs. As Carrie just shared, we have implemented many isolation and quarantine orders, which means that those individuals who are sick had close contact with people who they could have transmitted this virus to. And so we all need to just be very, very diligent about our interaction with others, ensuring that we're staying home and as much as we can, unless we're out meeting our basic needs or fulfilling an essential function. And even in that situation, making sure that we're physically distancing ourselves and staying home when we're sick. The other thing I just wanted to talk a little bit about, and I think it's still evolving, is this use of personal use of masks by the public. As we've talked about, we really want to make sure that we're securing a good supply of medical grade masks for our healthcare workers. And so I think we're going to see this recommendation evolve in terms of that's an additional way that the public can protect themselves using a homemade mask when you're out meeting your basic needs, ensuring that when you're doing so that you're also maintaining that 6 feet distance. It's just an additional layer. It doesn't replace that physical distancing. We're really seeing our numbers go up now. Our numbers are doubling about every 4 days right now. And so we have begun, and this is going to get worse. And I think that we all really need to take extra care to protect ourselves and our loved ones. So that's really all I had today. Thanks, Carrie.
All right, thank you, Dr. Ramstrom. Does anybody else have anything to share before we open up to media? Okay, hearing none, we are ready to take your questions.
I've got a question for Sheriff Magrini and Chief Couvea perhaps as well, as far as how does this new system work? What role do you see yourself playing, your organization playing in this?
So, good question, Mike. I talked about, the county has implemented this emergency operations plan. I think back in 2014 was when it was ratified. And it's a plan that just outlines the incident command system and structure. So it helps just with the organization, because as this continues to grow and we add more people, more employees are get brought in to assist with this, just trying to coordinate those efforts. And again, this wasn't a lack of anything. We had certain trigger points set, and we reached one of those to where it was now time to initiate this this plan, which brings in both the law enforcement and fire branch, just as the organization, administration, and operational efficiency with this. Does that answer your question?
Somewhat. What role do you see the sheriff's office playing in this? Like, where would you fit in?
Sure. So, being in unified command, the sheriff's office, have assigned an incident commander to the team, as has CAL FIRE and Health and Human Services. Myself, Chief Couvea, and Mr. Ewert remain as administrative heads of those agencies, and respectively. Additionally, from the sheriff perspective, we have, like I said, we've assigned an incident commander to the team. We've also brought in our coroner, our chief deputy coroner. He is in the command structure as well, as for obvious reasons, and coordinating with the hospitals for decedents, for surge capacity in our morgues and things of that nature. We also have a lieutenant that runs our Emergency Operations Center, our EOC, who is also assigned and will be stationed or housed at the same facility within the incident command post that we've established. And then we are also going to start standing up or assisting in tracing through different investigators, which we're receiving training now from Health and Human Services, Public Health, on how to facilitate that. So we'll be assisting in doing the tracing as this continues to grow and more people are affected.
Thank you, Sheriff. And then does Chief Couvea have anything to add as far as how fire fits into this?
Yeah, well, to reinforce what Sheriff Magrini is saying, we are part of the emergency management plan for Shasta County, being the Shasta County Fire Department Chief and Fire Warden. At a larger scale, and as I previously mentioned, we're in a support role for HHSA and public health, coming in, having a lot of experience with large-scale incident management. And as I said before, an ICS organization doesn't matter. It works the same regardless of what emergency that we're dealing with. It's not just for fires, it's for everything. And having a little bit of experience and bringing some staff to the organization that can assist with the operation. It's critical to understand that for this organization to work, you have to put the people that are experts in each area that are needed in the organization into those positions. So in our case, we're assisting with the incident command, we're assisting with logistics and plans. It's important to note that many of the operational things, public health and HHSA are the experts in those areas. So we're supporting them, the operation, trying to contain and mitigate this pandemic in Shasta County and help them any way we can.
Thank you, Chief.
Other questions?
Yes, Sheriff Magrini, does this plan include any enforcement efforts in terms of social distancing, breaking up gatherings, so forth?
Steve, good question. So we have met collectively as the chiefs and the sheriff in this county, along with our DA, Stephanie Bridget, and we have set up a plan in place, primarily focused on education and kind of public pressure to help facilitate and encourage businesses to fall in compliance. We have links on our website, and our probation office is helping public health and going through those complaints, and we're going out and doing education as our primary component. We hope to not have to fall into an enforcement component of this. We don't want to go out and have to take a heavy stance with some of these businesses. We hope that they are being responsible, and we have had some complaints, and as we have gone out and done an education component and given letters and talked to those businesses, we found that they're falling in compliance. So thus far, there has not been a need for enforcement, and I'm hoping that that does not come to fruition.
Donnell, if I could just add a little bit to what the sheriff said. We do have a unit of people that are working on this issue, and I want to thank Tracy Neal, our Chief Probation Officer. She's got a bunch of staff that are taking the lead on following up on the complaints that we receive. We do have established a way for complaints to come in about businesses or individuals violating the order by having parties and so forth. And so they are, they're following up on those and talking to people in an educational way, as the sheriff mentioned. And we also have partnership from some state agencies that are going out and talking to some businesses. And as the sheriff mentioned, most of them are coming into compliance. And so there's been a lot of conversations, and I think that's the key, is really trying to engage businesses about the importance of reducing opportunities for people to gather for the reasons that Dr. Ramstrom mentioned. But we are engaged in that process and with several county departments as well as other cooperators.
All right, other questions?
I think this is a question for public health, though, because I think they take the lead on these issues before referring to law enforcement. But have you had an increase in child abuse complaints? And if not, are you concerned that that's because of the lack of contact that children are having with the outside world?
This is Donnell. I can take that question. One of our branches in Health and Human Services is Children's Services, and they do report that reports of child abuse and neglect have decreased during this period of time. And we do not believe that is due to a reduction in child abuse and neglect. We do believe that's due to the fact that children are not in their schools. They're not around other people who are mandated reporters that might notice something going on with them. So we do encourage family members to support one another, check up on family members who are trying to parent during this difficult time. It's very challenging and stressful to have everyone cooped up, and you have the school responsibilities and so forth. So we do want everyone in our community. That's one thing people can do. They can support family members with children, give them some respite, talk to the kids over video, and try to support those parents out there who are, trying to do the difficult task of continuing to support their families perhaps with jobs or other responsibilities, as well as parenting with the kids at home all the time.
I did get some questions in advance from Donnie Chamberlain, who is here with us today. I can see her name, but she had trouble with the audio last time. So I will read her first question, which is, there are some relatively young people included with the latest numbers of positive COVID-19 cases. Have any of these cases been contact traced to either the Shasta College Health Sciences building or the Bethel community, including the church and BSSM?
So I can just say that over the weekend, I haven't caught up with staff as far as the specifics and where some of these contacts have been connected, what institutions. We check in periodically, and those staff, though, have actually implemented the quarantine orders based on close contacts. And so I can say that we have had a number of younger people who are either cases or contacts of those cases, and those instances have happened in a variety of different kinds of settings, and we're continuing to follow up and monitor those.
Thank you. And the other question is for Mercy and Shasta Regional, and it says the field hospital is not for COVID-19 patients. Why not keep all the COVID patients in one facility rather than have them mixed in with general hospitals that are treating everything from maternity to heart patients? Was this a federal decision to have the field hospital designated for non-COVID patients? I believe that's for our hospitals. It may be a good one for Donnell too. Whoever would like to take that one.
Well, I unmuted. I'll go ahead and start it. So as far as a decision goes, I feel like that was the decision of this group, right? We did that together. We thought what was best for the hospitals, HSSA, and the county. So Donnell, shake your head I feel like we did that as a group. Back to the other question about sort of why not put the COVID patients at this field hospital. Our hospitals are set up with negative pressure. So our hospitals have a way to, I'm going to say, better contain this disease process than putting them in a field hospital. The field hospitals don't have the same environmental controls that we have. And then as far as segregating of services, again, we've talked before, modern day hospitals have mechanisms, again, environmental controls, mechanical controls to prevent I'm going to say the mixing of air, the fresh air from what would be considered contaminated.
Anybody else want to add to that answer?
This is Donnell. We did discuss this at length with our cooperators, our medical cooperators, and did come to the conclusion that the established hospitals would be the best place for intensive care. They have all the equipment, they have highly trained staff, they have the negative pressure. It doesn't make sense to take care of general lesser ill patients in those places and do people who are more sick in a temporary hospital. So that's why we're doing the acute care non-COVID-19 patients in the FMS. Try to clear out as many of those people as possible so that the hospitals can become more intensive care, establish more intensive care space within their facilities to treat the more seriously ill people with COVID-19.
All right, thank you. Other questions from the media?
Yes. Between Mercy and Shasta Regional collectively, taking away the areas that are needed for other non-COVID acute patients that can't go to a field hospital, how many patients would you be able to handle in the event of a surge between your two hospitals?
I know that our facility, we've converted a majority of our rooms over to a negative pressure room. So we normally have 11 negative pressure rooms in-house, and we have converted probably close to 100 rooms that we would be able to house positive COVID patients in a negative pressure environment. Other than that, we could expand regular patients. I don't know, quite a few.
Mark's. So there's Mark.
And Mark over at Shasta. Yeah, sorry, that IT things keep jumping in and out. For our negative pressure rooms, we have a total of 8 negative pressure rooms within the hospital, but then that unit that we have converted to negative pressure, it currently could go to 16 patients, but we could convert that to 32 patients fairly fast. But then also with our lower census that we currently have in our main hospital, if we saw a surge in our regular medical patients as well, we could be very capable of containing that surge as well.
Right.
Can you hear me? This is Mike Chapman from the Record Searchlight.
Yes, we can hear you, Mike. Thanks.
Okay. Another question about staffing that field medical station. In case we need some more hospital health workers there. We've heard of this one nonprofit called Shasta Disaster Services that has some donations. Is there any word on staffing in case we need it there at the hospital, the field hospital?
We are working on the staffing. We need literally hundreds of people to run 3 shifts there. It's a 24/7 operation. So we are in the process of tapping into a variety of sources for that, including the health corps, the state health corps that the governor has been working on. We're working on other local possibilities, and we will be putting together teams to work in that facility. Shasta Disaster Services does have some equipment. I'm encouraging them to make that available to our other hospitals to use for those seriously ill patients.
Another question about the field hospital. Is the county actually renting that from Advanced Redding? And then would the county be reimbursed by FEMA? Or I'm just curious on how the finances are working with that.
We do have an MOU with Advanced Redding rather than the city of Redding, since Advanced Redding is the leaseholder for the Civic Auditorium. We will be working out some financial arrangements with them for the services they're providing, because they are providing the space as well as some other vendored services that we'll be using. And we are currently making an estimate for what the operation will cost to report to Cal OES. And our understanding is that we will get an advance of some portion of that total cost that we can use, and then we can claim for the remainder.
Following up on that question, is there an estimate of just how much Advanced Redding is going to charge to lease that facility?
I don't have any numbers from them yet.
I've got a quick question for Donnell as well. Donnell, you mentioned at the beginning of this, 125 of those beds are being sent to Butte County. Do you know anything about where those are going? Is there a second FMS being set up there?
Yes, as we speak, that second FMS is being set up. Well, half of one, I guess officially. Down in Butte County, if you give me a second, I'll look at my phone and I'll try to get that location for you.
Thank you. I'd appreciate that.
In the meantime, we had a question about testing. Dr. Ramstrom, an update on our testing capabilities, if that has changed in the past couple of days.
So I can say at our public health lab, we have received some supplies, some extraction kits. So we are more comfortable actually with our capacity for those higher risk individuals, whether they be hospitalized or in congregate settings, exposed healthcare workers to patients who've been confirmed with COVID, that kind of a thing. So that's good news. We're working on a variety of options and have a lot of feelers out for other test opportunities and that have come along. And so we're hoping that all or some of those will come to fruition soon. We have seen that the number of commercial tests have actually gone up. And so I think as those commercial labs are getting more efficiency, that's also good news. And that's partly why I think we're seeing our numbers go up. Some of those tests that were collected a while back have come through finally. And so I think we're exploring a variety of opportunities and are continuing to just, plug away and get what we can, whatever, we'll take whatever we can at this point. So we're looking at all options.
Thank you, Dr. Ramstrom, and we will have more information as those things become set in stone. Any other questions from our media today?
I have one for public health.
I got the answer to Mike's question. I'm sorry to interrupt. My information is that the Butte County half of the FMS is being set up at the Enloe Hospital Rehab Center.
Okay, thank you, Donnell. When you're saying half, does that mean like it's half here, half in Redding, and half in Chico?
That's correct. 125 beds here and 125 beds in Chico.
Great. Thank you, Donnell.
I was going to ask about the COVID-19 positive cases. Is it possible that public health can say where those people live, what city or what communities, instead of just saying Shasta County? I asked that because the Los Angeles Times over the weekend had specific numbers for their communities. And if you can't give it, can you give a reason why you can't say specifically where they live?
So I can just say that, we're really careful with that protected health information. Whenever we're working with somebody who has a health condition, we're really take that privacy very very important to us. And so what we do is actually make sure that we are really diligent about identifying or helping that individual to identify who they might have been in contact with so that we can actually reach out to those individuals. We're also starting, as we see some trends, we might reach out to particular facilities or organizations that we might want to alert in case that we feel that they should also be aware. And so that's kind of what our practice is, and we'll continue to do that. I'm not sure how LA County posted theirs information. They're a different beast than Shasta County. I mean, I think, maybe they're posting it regionally. I don't know, but we could take a look at that.
This is Donnell. I just want to say that our privacy officer is the one who advised us on the amount of information we're releasing in order to maintain confidentiality. Los Angeles County has 10 million people. Shasta County has 180,000 people, and our geographies are not that dissimilar. So obviously our concentration of people is different. We have a lot of small towns. So it's one thing to say that someone lives in the city of Los Angeles, their gender and age or whatever, and it's different than saying that about someone living in Manton or Platina or Big Bend. So, it's not one size fits all. And, it's important for confidentiality is very important in communicable disease control because people do have a right to privacy. There can be stigma associated with having a disease. I'm not saying they should or that's right that happens. The last thing we want is people to not seek medical care for their conditions because they're afraid that their name is going to become public. So it's really sacred for us to maintain confidentiality. And our privacy officer has opined that the amount of information we're giving is the amount that we really can give out and maintain that confidentiality.
Okay, thanks. I'd also mention that Plumas County identified where one of their cases lives, so just throwing that out there. Thanks.
Any other questions?
Yes, there are stories of states and even individual counties having to compete with each other for PPE and testing materials. Is that dynamic at play here? Are you, I guess for Donnell and Dr. Ramstrom, is that dynamic at play here? And do you find, are you having to actually try to outbid other counties for these materials?
So what I can say, PPE in particular, I think we're started out in a really good place actually relative to some other areas because we'd been resupplied with some N95 masks after the car fire in several north state counties. And so that was really helpful. The way that the medical supply requesting happens is that when there's a need, we're tasked to first look locally to see if there can be redistribution of PPE. If we can't get it that way, then we actually have a process where we can look regionally. So there may be areas that have PPE, but not the population and so some of that can be redistributed. And then if in the last resort, then is to send it up to the state. I can't speak to how the state's making those decisions, but I think that they are likely, I think one of the main principles is that these orders are being met in a way that is not like to get people through like the next couple of weeks. So they're trying to get the supplies to the place that needs it immediately, not to actually allow one location to have a large supply on hand for a longer period of time. So they're continually doling out reserves that will get people through a period of time to meet their immediate needs. And so that's kind of where we are right now. In terms of this testing, we've heard mixed information. We've heard that some supplies have been redirected to some urban areas, but then I've also heard that, like, for example, for some of the point of care tests, that more rural areas are actually higher on the priority list. We haven't seen that come to fruition yet. So, I can't answer you comprehensively, but those are some of the things that we've heard.
Okay, we can take one more question this morning. Going once, going twice. Okay, with that then, I will thank all of you for participating today. We will be back on Wednesday with a live briefing, and as per usual, tomorrow, right around 11 or so, we'll post on our Facebook page and on our website just a written update from all of our hospital partners and others who have anything new to share. And we will see you again on Wednesday. Thank you everyone very much for participating.